Health Mentor.
Welcome to the Health Mentor. I am your doctor here, your health companion. Let's ride onto the screen.
Erectile dysfunction.
Understanding erectile dysfunction. Definition of erectile dysfunction. Erectile dysfunction can be called ED for short. It's a medical condition where a man experiences challenges in achieving or maintaining an erection sufficient for sexual intercourse. In simpler terms, it's like having trouble with the penile erection necessary for sexual activity. Erection difficulty *. This phrase refers to the difficulty a man might face in getting or keeping his plumbing working as it should. It's important to understand that everyone can have occasional hiccups in this department, but when it becomes a persistent issue, it's labeled as erectile dysfunction. Sexual intercourse *. Now, let's talk about what we're aiming for when discussing ED. Sexual intercourse is the intimate act that many of us engage in for pleasure and connection. It often involves the erect penis entering a partner's body, such as the vagina or anus. ED can make this part of relationship challenging. Prevalence. Prevalence means that how many people are suffering from erectile dysfunction. Now that we have talked of what erectile dysfunction is, let's talk about how common it really is. Common condition *. First and foremost, ED is not a common issue until and unless you have diabetes, high blood pressure, or any psychological issue. Although it's quite widespread, affecting a significant number of men. **** affects men of all ages. **** ED doesn't discriminate by age. It can impact men across the lifespan, from young adults to old. So, if you thought this only happens to older individuals, that's not necessarily the case. Increasing prevalence with age *. However, it's worth noting that as men get older, the likelihood of experiencing ED does increase. This means that while it can affect anyone, it becomes more prevalent as we age. Understanding the prevalence of ED is essential because it highlights that you're not alone if you're dealing with this issue. It's a common challenge that many men face, and there are ways to address it. There are three main causes of ED. 1. Physical causes or organic causes. 2. Psychological causes. 3. Lifestyle causes. Physical causes of ED. Alright, let's talk about some of the physical stuff that can lead to erectile dysfunction, or ED. It's not as complicated as it sounds. Diabetes *. This is when your blood sugar levels get out of whack. It's like trying to run a car on low-quality fuel. Your body just can't get the engine running right. High blood pressure *. Imagine your blood vessels are like pipes. High blood pressure is like putting too much pressure on these pipes. It can make it harder for blood to flow where it needs to, including down there. Heart disease. Think of your heart as the pump that sends blood all over your body. If it's not pumping well, blood might not get where it should, and that can affect your ability to get things going. Obesity *. If you're carrying extra weight, it can mess with your hormones and blood flow. It's like putting too much weight on a seesaw, things just don't balance right. Hormonal imbalances *. Your body's hormones are like messengers, telling it what to do. If these messages get mixed up, it's like your body speaking a different language. It can cause confusion in the whole system. Our minds are powerful, and they can influence our bodies in unexpected ways. Here are some psychological causes of ED, grounded in medical knowledge. Stress *. You know that feeling when everything seems overwhelming? Stress can do that. It releases hormones that can interfere with the body's ability to perform as it should, kind of like putting a speed bump in the road. Anxiety *. Think of anxiety as that nervous jitters feeling you get before a big event, but it's happening more often than it should. Anxiety can rev up your body, making it harder to relax and perform when needed. Depression * depression isn't just feeling sad, it's like carrying a heavy backpack of emotions all the time. It can drain your energy and make you lose interest in things you used to enjoy, including intimacy. Relationship problems * imagine your relationship as a well-choreographed dance. When things get out of step, it can create tension that affects how well you move together. Relationship issues can be like static in the radio signal of intimacy. Lifestyle causes of ED. Let's dive into some lifestyle choices that, based on medical facts, can impact erectile dysfunction or ED. These are things you have control over. Lifestyle choices are like the steering wheel of our health, and they can steer us toward or away from ED. Here are some lifestyle causes grounded in medical knowledge. Smoking * you know how smoking is bad for your lungs. Well, it's also not doing any favors for your blood vessels. Smoking can make them narrow, like squeezing a water hose, making it harder for blood to flow where it needs to, including down there. Excessive alcohol consumption * sure, having a drink or two can be enjoyable, but too much alcohol can dull your senses and impact your body's ability to function. Think of it like a car engine running on low-quality fuel, it just doesn't perform at its best. Lack of exercise * imagine your body is a machine. If you don't use it, it can get a bit rusty. Exercise keeps things running smoothly, including blood flow to all the right places. When you skip exercise, it's like putting your machine in storage. So, these lifestyle choices can play a part in ED. But the great news is that you have the power to make positive changes. Stick around because we're going to explore ways to improve your lifestyle and reduce the risk of ED. Pathophysiology of erectile dysfunction. Pathophysiology means what's wrong happened to our normal body function, which leads to erectile dysfunction. In man's penis, there is a place called corpus cavernosum, which consists of highly vasculature area. When the blood vessels dilates in the penis dilates, the blood accumulates inside the corpus cavernosum, and the penis becomes enlarged and erected. This occurs normally, but what happens during erectile dysfunction? When the corpus cavernosum of the penis do not retain or accumulate the blood inside due to not proper blood vessels dilation or improper blood flow, the penis is unable to erect, strong and enlarge. The improper blood flow to the penis and improper blood vessels dilation seen in diabetes and in high blood pressure and other psychological conditions. The improper dilation and blood flow is the root cause of erectile dysfunction. The treatment with the help of medication targets and ensure proper blood flow and proper blood vessels dilation within the penis. Understanding risk factors for ED. These are important factors based on medical facts that can affect your chances of experiencing ED. Think of these risk factors as signals that can make ED more likely. They're like signs on the road, guiding us towards potential challenges. Here are the key risk factors. Age. First up, we've got age. Just like our hair turns gray and our bones get a little creaky as we get older, the risk of ED can go up too. It's like a natural part of the aging process. Medical conditions. Sometimes, other health issues can set the stage for ED. Conditions like diabetes, heart disease, or high blood pressure can affect the blood vessels and nerves, making it trickier for things to work as they should. Lifestyle. Now, let's talk about lifestyle. Our daily choices play a big role. Smoking, excessive drinking, and a lack of physical activity can all increase the risk of ED. It's a bit like putting extra weight on your shoulders. It can make things harder on your body. Diagnosis of erectile dysfunction. How the doctor finds that you have erectile dysfunction. We're talking about how doctors figure out if someone has erectile dysfunction, or ED. It's a bit like detective work, but let's keep it simple and understandable. When it comes to diagnosing ED, doctors follow a few steps, just like putting together pieces of a puzzle. Here's how they do it. Healthcare provider. First, you'll want to reach out to a healthcare provider. These are the experts who can help you figure things out. It's like calling in a professional to solve a mystery. Discussing symptoms. Next, you'll have a chat with your healthcare provider. You'll talk about what's been going on, like trouble getting or keeping an erection. It's like telling the detective about the strange things you've noticed. Medical history. Your doctor will also ask about your medical history. They want to know if you have any health conditions or take any medications. Think of it as giving the detective some background information. Physical exams. Sometimes, doctors will perform physical exams. They'll check your body for any signs that could be related to ED. It's similar to the detective looking for clues at a crime scene. Tests. In some cases, your healthcare provider might recommend tests. These can include blood tests or special tests to check the blood flow to your downstairs area. It's like using scientific tools to gather evidence. Treatment options for erectile dysfunction. How to tackle erectile dysfunction, or ED, with treatments grounded in medical knowledge. Let's dive right in and keep it easy to understand. When it comes to treating ED, you've got a few options. Think of it like choosing the right tool for the job. Here are your options. Lifestyle changes. First up, making some healthy life choices. That means eating better, getting regular exercise, and kicking habits like smoking or overdoing it with alcohol. It's like giving your body a tune-up. Medically proven Kegel exercise. Kegel exercise is the only cure for ED. I will make another detailed video about this exercise counseling. Sometimes, ED has its roots in your mind. So, talking to a professional can really help, especially if it's related to stress, anxiety, or relationship troubles. Think of it as a mental tune-up. Medications. There are medicines available that can improve blood flow, making it easier to get and keep an erection. These can be a bit like a boost when your body needs it. Surgery. In some cases, surgery might be an option, but it's usually considered if other treatments haven't done the trick. It's like fine-tuning a machine to make it run smoothly.
If you have any question or confusion, please reach out me in the comments section. Encourage me by subscribe Health Mentor for more videos. Thank you. See you for the next time.